The type of tea we drink does matter, just like any medicine, when it comes to health benefits. It is important to consider your caffeine sensitivity before choosing any type of tea for health purposes. Usually, the best types of teas are made from the Camellia sinensis shrubs such as black, white, green, and oolong tea. Black tea. Black tea is highly oxidized, which is why it is black in color. Most doctors advise coffee-drinking heart patients to switch to black tea since it has half the amount of caffeine in the same quantity of coffee. Research showed that people who had 3 cups of black tea daily had lower triglyceride levels and improvement in their cholesterol levels. However, black tea has caffeine and might not prove to be a good choice for people with very high blood pressure or a fast heart rate. Also, it may decrease the clotting of blood, which makes it unsafe for those taking blood-thinning drugs. Green tea. Green tea is prepared by harvesting the leaves, leaving them to wither, and then steaming them, which means there is no oxidation. Heart specialists suggest drinking green tea as much as you can if you are a regular tea drinker. However, it is advised not to take in with sugar, or it might lose its good effects. Green tea is proved to lower LDL cholesterol levels and triglycerides, which means it is good for the heart. Green tea is very beneficial for heart health as it reduces the risk of heart disease and death from heart stroke or attack. Green tea also contains very powerful antioxidants that help prevent atherosclerosis, the accumulation of plaque in the arteries. It also boosts one's metabolism, which eventually makes it easier to maintain a healthy weight. Moreover, the tea also improves the function of specific cells in the bloodstream. White tea. White tea is a type of tea that comes from the young buds of the tea plant and is processed very briefly. Most specialists suggest that it is the purest tea and is good for heart health. The flavonoids present in white tea help dilate the arteries, which ultimately lowers blood pressure, reduces cholesterol, and even prevents blood clotting. The tea is not only good for the heart but also the whole circulatory system. Oolong tea. Oolong tea is made by heating crushed and oxidized tea leaves. It is known to help patients with coronary heart disease by lowering blood cholesterol levels. Also, it reduces triglycerides and food intake. However, if one is planning on taking oolong tea, he must consult his heart specialist. Chamomile tea. Chamomile tea is an herbal tea, which means it does not really come from a tea plant. However, it still has a number of benefits for health. It has an indirect benefit for cardiac health, that is sleep. Most heart patients have issues like they don't get enough sleep. Sleep is very significant for every human being. Chamomile tea helps soothe the body and makes it easy for one to have a peaceful night's sleep. Ginseng tea. Ginseng tea is a natural blood thinner and is known to boost heart health. It relaxes the arteries, therefore, lowering blood pressure. This type of tea functions as a blood thinner as it blocks platelet adhesion. Furthermore, tea also improves cholesterol levels. Ginseng tea is a tasty substitute for a sweet beverage and also has a lot of benefits to boost heart activity. The tea not only works as a slimming agent, but also reduces the intake of excess sugar that is harmful to the heart. Final verdict. Our final verdict is green tea is the best type of tea for preventing heart disease. It is a light and aromatic tea which significantly lowers LDL cholesterol and triglycerides. These elements are responsible for death from a stroke or heart disease. Studies have shown many possible links between green tea and heart disease. People who drank up to 5 cups of green tea daily had a 26% lower chance of death from a stroke than people who drank little or no cup of tea. In addition to this, people who had more green tea had a lower risk of coronary heart disease than people who did not. Green tea has a potential relationship with the benefits provided to the heart. However, there are quite a few side effects of this tea. It is reported that it can raise liver enzymes and is also a major source of oxalate, which might lead to kidney stones. Hence, it can be said that drinking more than 6 cups of green tea will have more risks than benefits. So, if consumed sensibly, it can greatly improve one's heart health. At South Florida Cardiovascular Specialist, our experts will provide you with the best treatment and advice. You can consult us to get help with heart disease prevention so that you get to live a happy and healthy lifestyle.